In this episode, we're going to talk about and hear everything that we need to hear about blood pressure. And our guest today is Dr. Richard, who is a family medicine doctor and one of my close friends. So I just wanted to welcome you to the episode.
Thanks very much, Patrick. Nice to be here.
Thank you. So, Richard, before we get started, just so our viewers know, so could you give us a little bit of an idea about your experience, your background in medicine, and of course, how you got to know so much about blood pressure?
Sure. So I'm a UK-trained family medicine consultant. I've got 10 years of experience in the UK and then 10 years in the UAE. And basically, within family medicine, blood pressure is one of our bread and butter type of disorders that we have to deal with day in, day out.
All right. Fantastic. So let me ask you, right off the bat, I'd like to know, I'm on blood pressure meds and my blood pressure meds seem to be okay. But what is a good range for people, right? So when I first started, I came in to see a doctor and I was 140 over, I think, 100 or 105 before my wife actually pushed me out the door and into a cab and to the doctor. So, I know that that's high, but what's a low, medium, decent range? Like, what do the numbers mean?
I mean, basically, I think we have to start at the basics with what the numbers mean. And when you take your blood pressure, you get the two numbers. So we won't go into how you take your blood pressure at the moment, but basically you get those two numbers. You get the larger number on the top and the lower number on the bottom. And the larger number on the top is the pressure in your body as your heart beats. You get that pressure, and that pressure is measured, okay? The lower number is as your heart is relaxed and is refilling, ready for the next pump. That's the pressure. So it's the system's pressure that's the lowest it gets to, okay? So those two numbers come up. You also get you'll get your pulse rate, your heart rate, as part of that when you take your blood pressure. So those numbers are obviously important. As you say, there are ranges and there are safe ranges, there are intermediate ranges, there are danger ranges. Mm-hmm. It varies from person to person what those are because, and also from different sexes. So females often have a lower normal blood pressure than males. But basically in the medical community, really the understanding is that about 135, the upper number, over around 70, 75, this is the healthy range, okay? As I say, it depends on from person to person. And also if you have any underlying other problems like diabetes or cholesterol or anything like that, often those are even tighter to get to a lower level because you have added risk factors for blood pressure.
So, in my case, for example, I'm on blood pressure meds, and I've been told all my life that I have to do certain types of lifestyle changes. Now, perhaps for me, I'm a little bit more knowledgeable of it because of LU Health, but for some of our viewers, they may not know this. Is it this or that, or is it, a combination of both?
I think they've got to go hand in hand, basically. When you are first diagnosed with blood pressure problems, often it's an easy option just to look at the meds and take the meds.
You've spoken to my wife then.
So, because lifestyle changes are difficult, they're not easy to do. We all get into our habits and our set ways, and we don't like to change these things. But they are equally as important as medication. And even sometimes can take the place of medication in the right circumstances and under the right monitoring. So lifestyle changes are really important. Obviously, medication, if you need it, you need it. And it can be life-saving medication because blood pressure has all sorts of dangers if you have high blood pressure. Hidden dangers often. They call it the
silent killer, no?
Silent killer. Because it doesn't really cause any symptoms a lot of the times until it's too late. It's caused damage over a long period of time.
So thank you. What are some of the symptoms? For me, I remember not so long ago, because I'm still on the meds, but I'd wake up with what I thought would be a headache, right? So I think that's one of them. But are there other symptoms, or is it kind of, you just have to check it?
Yeah, I mean, some people can be very sensitive to their blood pressure and have symptoms right off the bat. Others, they can go on for years and years with high blood pressure and know a thing. So yeah, the symptoms can be things like headaches, visual problems. Sometimes having even fatigue can be a soft sign.
That was another one for me,
blood
actually,
pressure.
fatigue, for sure.
Yeah.
Are there any symptoms to, I mean, we talk about high blood pressure, so that's a problem.
Mm-hmm.
Is low blood pressure a problem?
Well, the flip side, it can be a problem. It's safer in a lot of circumstances, but if it gets too low, you then get dizzy, you can fall over, hit your head, and that's when, sometimes you can be over-treated for blood pressure. So you had high blood pressure, you were put on treatment, things improved, you really got your lifestyle changes sorted, but you're still taking the same dose of medication, and suddenly your blood pressure is dipping. Too low, then you can actually
that actually happened as well, because I remember I was on a very high dose when I first started, but then as I started to lose weight, which we'll get into, some of the perhaps self-care that we can start to undertake. But I remember a point in time, I went to see my cardiologist, and he told me your dose is too high now, right? And he cut it in half, and then in half again after that. When is a good time to? First of all, how often do you record your blood pressure? Do you do this on a regular basis, once in a blue moon? In my case, I don't want to know what it is. So as long as I don't know what it is, I don't do it. But I've been taught that that's not a good idea. So don't follow me, guys.
No, I mean, obviously, some people avoid taking their blood pressure because of that reason. They don't want to see it too high. Some people get very anxious and nervous when they have their blood pressure, and it automatically puts a false blood pressure reading. So you get a high reading. So you have to be relaxed. You have to try and be relaxed when you do it. It's best to have rested and not been moving around too much for about 5 minutes before you take it. But I would say if you are not controlled in your blood pressure, i.e., any of the medication or lifestyle changes you're doing, you're still having high levels, you do need to monitor it more often than when it's nice and stable and controlled, because then you're out of the danger zone.
So is once a day a good thing, or is like 3 times a day, or is it 6 times a week? Because I remember we had seen some research out there. I think it was the American Heart Association, that they said that if you monitor it a minimum of 6 times a week, then you can reduce the chances of a cardiac episode by 50%, which for us, for myself, our viewers, I think that's very important, because that means no heart attacks. I mean, that's kind of where it will lead to.
Yeah, absolutely. I mean, I think the point is knowledge is power, because if you don't know about it, if you're not checking these things, then you cannot observe them and therefore do something about them. So regularly checking your blood pressure, 6 times a week was in the study. That was what the cutoff they said. But I would say, most days, if you're having a blood pressure problem, you should check your blood pressure most days, but alternate and mix it up on the times of day and things like that, so you get a good average, and make sure you record these down, which is really important.
Recording it is very important. So what happens when you see patients, how do they record it? Do they come in with an app? Do they come in with sheets and reams of paper? What do you do to sort of track your patients? Do you just take the snapshot of the day? Because I've heard of the white lab coat effect. Now, I'm the opposite, right? So I know I have to go see my cardiologist 3 weeks before. I'm eating properly. I'm exercising. I'm doing all the right things so I can go in and, look great. But for others, I think there's the pressure of going to see a doctor that raises it, right?
I mean, when you go and see a doctor and you have your blood pressure done in the clinic or whatever, it's a snapshot. It's right at that moment in time. And as you say, either for your case, you've really worked on your stuff the few days, so
I've gamed the system,
so you can get a gold star from the doctor.
Sure.
Or you can,
and a lollipop.
or if you haven't and you get anxious when you go see the doctor, you have this what they call the white coat effect. And basically white coat hypertension, they call it. And it's really, your blood pressure is high just because you're anxious to see a doctor, not just even that you've got a blood pressure problem.
Yeah.
So it's important to get values spread out over time, and at different situations, different times of the week, different days, different time of the day. When you're working, when you're not working, when you've had some rest and relaxation, when you haven't had rest and relaxation. If you get
That's
those,
very difficult to track, though, right? Like you get Excel spreadsheets from your patients.
yeah, I mean, this is an issue. You know, we will get, for a lot of people who are very into tracking their health and everything, they'll come in with Excel spreadsheets. Some of the monitors, keep record of the last 20 maybe, but they'll come in with hundreds of values. And it's very difficult to then be able to scan down and see what is their average running at. And so, really, there are some apps out there that we can use to do that. Some are just blood pressure focused, some are multi-factorial for health.
So now a couple of things. I don't want to lose my train of thought on this, but you brought up some good points here. So before we get into some of the lifestyle changes you can do, so I have a Omron, right? So that's just one of the companies that I know about.
Yeah, sure.
I went and I picked it up from a store.
There are other brands available.
Yeah. So what are they all good? Now you're not sponsoring anybody or being sponsored by anybody, but do you take one type of brand over another, or as long as they're a well-known brand, they work well? Number one. And what are some of the brands that are out there? Because I've seen Omron, but I've also seen other names. But does it matter for you, or are there ones you stay away from?
Well, I think it's hard to say the ones that I don't trust as much. I think it's easier to say the ones that I've used and the ones that I've got experience with, and they're mainly the ones that the hospitals and clinics will fit out their clinics with, and they're obviously tried and tested. They're big companies. They have a lot of data to show that they are very accurate, or as accurate as you can be.
Right.
So Omron is a big one. Welsh and Allen is another one. Philips is another. So there are many, but these are the ones that I've mainly used in these situations. If you are in a pharmacy or a store that stocks these, obviously you can take some advice from the people who are in there. They should be directing you to the most reliable brand.
Fantastic. So what's better? I take everything from my arm, but I've seen some wrist ones as well, right? So does it matter where you take your, I guess you don't do it on your leg.
Well, it can be done on the leg in the right situation.
Awesome.
Sometimes
tried to make a joke and it fell flat on my face. Great, thank you.
But this is more mainly hospital based. If it's needed, you can take a blood pressure from any limb really. I mean, basically, the arm cuff is the one that's well known, and it's the easiest to use as far as if you have someone helping you. Although there are some that become easier to use on your own. The wrist one is probably less accurate, and the reason for that is the vessels are smaller. So as your blood vessels are getting smaller, I think getting the readings correct are a bit more of an issue. Using the cuff here, you've got your large vessels here, which basically get squeezed, and as the pressure comes off, it senses when the actual blood is starting to flow, and that it calculates the pressure.
Okay, so which is good to know, because that's one of the machines that I have, and I wanted to stay away from wrist, but more to do with the fact that I have an old blood pressure machine, but I refuse to change it for one with a Bluetooth enabled and all of that, just because I figure if it does the job. So as long as it's, let's say, preference number one is arm, preference number two is wrist. Would that be fair to say?
Yeah, sure.
Okay. Yeah. So now we get to the other part of it, which is what are some of the lifestyle changes that we can do, right? So I talked about, for example, I've lost weight. But as much weight as I've lost, my blood pressure has not gone down that much that I can get off my meds. So, is that a hereditary thing, or is there other things that I can do over and above?
It's multifactorial, the treatment of blood pressure. You can't just treat it with one thing. Medication alone it can obviously drop your blood pressure, but if you're not going to change your lifestyle, you're going to end up just upping and upping and upping the doses, which leads to things like side effects and other problems and knock-on effects really on your body system. So with the lifestyle changes in conjunction with any medication, things like, so the sort of top 5 that you're going to be looking at if you want to do it that way.
We like top 5s, top 7s, top 3s, bonus tips. So please go for it.
So your top 5, you're looking at basically you've got to be moving. You want to exercise. Okay. You really need to get your body moving to get your heart working, your lungs working. The fitter your heart and lungs are, the lower your blood pressure is going to be, and as a general rule. Okay. If you're not used to exercise, you need to start slowly and gradually build that exercise up. Start with just walking, walking regularly every day, 30 minutes or so. Get yourself moving, get that heart working and your breathing.
So I heard, sorry to interrupt you, but before we go to tip number 2, so I heard, for example, if you're over 100 on the lower number, which is the diastolic, right? If you're over 100, maybe it's not a good idea to start off by hitting the gym hard, right? And just start off by walking, or is that a myth?
Yeah,
or best practice.
Yeah, but it's best practice if your blood pressure is very high, not to overexert yourself and overexercise. This is why you need to be doing this with a physician's knowledge and with a direction of your doctor, because they can give you individualized advice for you,
right?
And that's super important, because I can't tell everyone one fits all. This is general advice, but everyone's different.
Yeah, so this is a good point in time to say that this is not medical advice, guys. This is just general information. If you need to see your doctor for a diagnosis or consultation, please go and see a doctor and just treat this podcast as help and self-care recommendations. Right, sorry.
Yeah, no.
Back to our regularly scheduled programming. Always wanted to say that. So keep going. So number 1 is keep moving.
Yeah. And exercise and gradually build that up. If you're not used to the exercise and or if your blood pressure is high and not controlled, you want to slowly bring that in.
Yeah.
Number 2, which is equally as important, is diet. You really need diet, and nutrition is really a big factor, and you cannot exercise your way out of a bad diet, is the phrase that I always use. Now that the main things you have to avoid are things like salt in your diet, and especially sodium salt, so sodium chloride. Now that's the cheap typical table salt that you get. It's the salt that's added to a lot of cheap processed foods, junk foods, all of these kind of things, because it gives immediate flavor and it's cheap. But it is the worst thing for people who have a blood pressure problem, and it literally can change you from being way over to being not at all in having a problem with blood pressure.
Wow. Okay.
So just in cutting all of that out, you're going to be doing yourself the world of good. What you should do, especially, and I know it's really difficult to change taste, if you really like your salty stuff or salty food, or add salt to your dinner, you must look for things like high potassium chloride salt. So it's one which has a high percentage of potassium chloride, low sodium. And potassium actually helps your blood pressure in control.
I have so many questions about that, because for me, for example, in my culture, right, being a Mediterranean, Middle Eastern culture, salt and sweets, right, like that's kind of our thing.
Yeah.
Sprinkle a bit of hummus around that, and we're good to go. So is that good, bad? Like, obviously, sweets does not work from the sugar standpoint. But can we do it in moderation, or when you're starting off, you just have to cut that out?
I think all lifestyle changes are going to take some time. You're not going to do it. Well, most people will find it difficult to do everything and cut everything out overnight. Yeah. But I think it's taking a bit of each of them. And if you can reduce or take a little bit of advice from all of these tips and add them all together, you'll get a much bigger result.
Right on.
So, I'm human, and I understand it's difficult to change. I find it difficult to change these things as well. But basically, if you just do some, you're doing better than none. Mm-hmm. So the salt thing is not easy, especially if you go into a restaurant, let's say, because a lot of times pre-prepared food or food that you get in a restaurant does have salt for taste. You can always ask for low salt options. I actually take some potassium salt with me in a little pot, just if I need to add it for a bit of taste. It's an alternative. It's a thing that you can do. But it's really the things like junk food and processed food, ready meals, things like that, which
Yeah.
have just so much salt in, unfortunately.
Yeah, that's what makes them taste good, right? So, okay, so that's 2 tips. What's your third one?
So the third one, basically, we'll be looking at, you mentioned you lost weight.
Yeah.
Now, weight loss is a big challenge for a lot of people, and that's a completely separate podcast almost.
Yeah.
But
We'll have you back.
but if you are classed as overweight, you're going to do your blood pressure the world of good by trying to lose some of that weight. Now, the first 2 tips, moving and diet, is going to help you with weight loss. But really looking at your calorie intake and portion control, it's not easy, but it's this is the ways to try and reduce your weight alongside the exercise.
For sure.
And if you can do that, then you can really drop your blood pressure again. As I say, all of these things, if you're doing a little bit of each, you're going to help your blood pressure
All of
down.
it kind of helps
it has
move
a
the bus forward. Yeah, move the
cumulative
bus forward for sure.
Yeah.
All right.
Yeah.
And what's tip number 4?
So we'll probably be looking at things like stress reduction, because stress in our lives is a big problem when it comes to pushing up your blood pressure. So
The Seinfeld reference, Serenity Now. Serenity Now.
So basically, I would do everything in your power to reduce stress in your life. Now, obviously, I can't take you out of your stressful situation, whether that be home life, work life, financial stresses. They're all there. Relationship stresses, anything like that. You can't necessarily remove yourself from those, but it's how you deal with them. And really self-care and taking some time out for yourself. We use the term mindfulness. We're talking really having some time on your own and doing either something you enjoy, reading, doing anything that's going to relax you and take your mind out of the stressful stuff. I listen to nice music, just calm music. I do breathing exercises if I'm particularly stressed. These can all help, but reducing.
I like to close my eyes, pretend I'm meditating, but nod off just for 5 minutes. Does that work?
Yeah.
Yeah. All right.
It will help. It will help for sure.
Mindfulness accomplished.
Exactly. It's all because your stress hormones, your adrenaline, and everything is up when you are stressed, and all this has a massive impact in your heart rate. So your heart rate's pumping very fast, very big volume, and that pushes your blood pressure up. So you just need to reduce that adrenaline effect and other hormones that are involved in the stress response by doing these things. But doing something that you enjoy.
All right. So last one, tip number 5.
So the last one I would say is getting good quality and good quantity of sleep, because all of the advice I've given so far, if you haven't got the energy because you're so tired,
Right.
you will lack motivation. All of those factors will not allow you to do those top 4 tips. But then, if you get those top 4 tips right as well, it also helps your sleep. So it's a bit of a cycle.
Right.
And if you can get them all going together on top of any medical treatment, you're going to be getting your blood pressure under control in no time.
Well, speaking of blood pressure control under no time, so let's say, for example, I was to start today to make as many lifestyle changes as possible and get on my meds because I'm pretty high up. What's the normal amount of time, or is there a normal amount of time by which you start to see things go down, or is there a lag? Like, how does it work? Because there are some people that have asked me, just because of the nature of Value Health, right? Like, I've been on meds for a month and I've been taking care and changing my lifestyle in that last month, and I haven't seen the big dips. Is that normal, abnormal, or is it, just part of the process? Does it take time to move blood pressure upwards, and does it take time to bring it down? Like, how does it work exactly?
I think, again, you can't individualize it because everyone's going to be different on this.
Yeah.
But as a rule, you can change your blood pressure very quickly. If you were to put into action all of these things at once, you can change it within a few days. Literally that fast.
Wow.
But sustaining it. This is the other problem. If you are that dramatic with your lifestyle changes, sometimes people say, right, I'm stopping this, that, the other. I'm going to increase my exercise, everything like that. It's about sustainability. So sometimes it's better to do slightly less changes, i.e. less drastic changes. And that will take a little bit longer to actually get your blood pressure down.
But be consistent about it throughout,
because,
right? So
because you'll be consistent and it's manageable. It's something that you can then continue.
It's not the up and down of stop and go and stop and go. Because I think one of the biggest issues that I've had in terms of managing and maintaining my blood pressure is the motivation of managing and maintaining my blood pressure, right? Like as soon as I see that my blood pressure has gone down, to me, that's an invitation to kind of slack off a little bit, right? And then it goes back up and I have to go right back onto things. And, it's, for some people, myself included, it's kind of an all or nothing. But what I'm hearing from you is do less of that and a little bit more steady as she goes.
Yeah, I think so. Obviously, if your blood pressure is very out of control, then, my advice is to do as much as you can, as quickly as you can.
Sure.
But it is the sustainability of it all. I know how difficult it is to change these things and to keep them going, to sustain them. So yeah, I think take a little bit of each of these tips, and if you can just do a quarter of what I've said for each of those, then you're going to be getting somewhere.
Fantastic. So just so that we can dock the boat, if there's a way to summarize our discussion, how would you summarize it for someone who's just, jumping in now and missed all of this good stuff before and just wants to hear, the Coles notes of it?
I mean, basically, blood pressure is not one fits all treatment. You have to take it all in combination.
Yeah.
Lifestyle changes are important as medication. Taking your medication correctly is as important as the lifestyle changes, but doing it all under supervision of your doctor is crucial. But if you do all of those things, the medication and the lifestyle changes, you're going to lessen your need for medication for a start.
Or at least the dosage, right? Like the dosage will go down. You might always be on meds as I am, but I can definitely tell you my dosage has gone down.
Dosage would definitely change, but some patients have been able to come off that medication under my supervision because they have done so well in all the other areas, and then you monitor it after that because you could need it back in the future.
Fantastic. So thank you very much for agreeing to do this inaugural podcast. And if you'll come back, we've got some other questions and other topics if you're all right with that.
I'll be delighted.
All right. Bye, guys.